Never give up. If you want your dream to be a reality when it comes to being a nurse, you better never give up, because it's always going to be a dream, because only you can put the work in. All right. So question number 21. Jose is in danger of respiratory arrest following the administration of a narcotic analgesic. An arterial blood gas value is obtained. Nurse Oliver would expect the PaCO2 to be which of the following values? All right. Is it 15, 30, 40, or 80? All right. But the answer is D, 80 millimeters of mercury. A client about to go into respiratory arrest will have insufficient ventilation and will be retaining carbon dioxide, or CO2. The value expected would be around 80 millimeters of mercury, right? All other values are lower than expected. That is reduction of risk potential, which is 9 to 15% on the NCLEX exam. That's the fourth largest section on the NCLEX exam based off of the 2023 NCLEX test plan that came out last year on April 1st. Not a joke, not a game. This is real. And if anybody ever wants to see that, you guys can, go over to the ncsbn.org and look it up. Question 22, Timothy's ABG results are the following. It's a pH of 7.16, a PaCO2 of 80, a PaO2 of 46, a bicarb of 24, an SaO2 of 81%. These ABG results represent which of the following conditions? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, or respiratory alkalosis. What are we thinking? And the answer is C, respiratory acidosis. Shout out to all of y'all that got that question right. Reduction of risk potential, 9 to 15% on the NCLEX, making it the fourth largest section on the NCLEX exam. Because PaCO2 is high at 80 millimeters of mercury and the metabolic measure bicarb is normal, the client has respiratory acidosis. Here we go. Question number 23. Norma has just started a new drug for hypertension. 30 minutes after she takes the drug, she develops chest tightness and becomes short of breath and has tachypnea. She has a decreased level of consciousness. These signs indicate which of the following conditions? Is it an asthma attack, pulmonary embolism, respiratory failure, or rheumatoid arthritis? What are we thinking? The answer is C, respiratory failure. The client was reacting to the drug with respiratory signs of impending anaphylaxis, which could lead to eventually respiratory failure. That is physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Light work, I see you. You know what I'm saying? 11 to 17% on the NCLEX exam, making it the third largest section on the NCLEX exam. Here we go. Question number 24. Mr. Gonzalez was admitted to the hospital with ascites and jaundice. To rule out cirrhosis of the liver, which laboratory test indicates liver cirrhosis? Is it decreased red blood cell count? Is it a decreased serum acid phosphatase level, an elevated white blood cell count, or an elevated serum aminotransferase? And the answer is D, elevated serum aminotransferase, right? Delaware, that's a state. I'm just playing. Guyana, okay. Hepatic cell death causes the release of liver enzymes, ALTs and ASTs and D or LDH into circulation. Liver cirrhosis is a chronic and irreversible disease of the liver characterized by generalized inflammation and fibrosis of the liver tissues. That's a reduction of risk potential, which is 9 to 15% on the NCLEX exam. All right, for both RNs and LPNs. All right, LPNs, I need for you to really understand this. You learn the same content that the nurse learns, that the RN learns. You're both nurses, but the RN, you learn the same content. You just need to know what you can and cannot do and what you can and cannot accept. Ladies and gentlemen, question number 25. The biopsy of Mr. Gonzalez confirms the diagnosis of cirrhosis. Mr. Gonzalez is at increased risk for excessive bleeding primarily because of what? Is it impaired clotting mechanism? Is it varix formation, inadequate nutrition, or trauma of invasive procedure? What are we thinking? And the answer is also A. All right, it is impaired clotting mechanism. Cirrhosis of the liver results in decreased vitamin K absorption and formation of clotting factors resulting in impaired clotting mechanisms. That is reduction of risk potential, which is 9 to 15% on the NCLEX exam. 9 to 15% on your NCLEX exam per the NCLEX test plan. Okay, 9 to 15%, fourth largest section. So shout out to all of y'all that got that question right.